morning, everyone. Yes, as I've been introduced, my name is Alex Mwangi, and I shall be presenting my abstract. Mine is not a research per se, but it's an intervention abstract in which we gathered with my colleagues, the members of Peers Action, or CBO in Dandora. We are a CBO that advocates for SRHR among the adolescents and young people in Dandora, mental health and drug abuse. And we just came the whole of it, but it's okay. So we have 4 thematic areas that we're dealing with, and first of all, the title of the abstract is The Boy-Child Focus in SRHR, Mental Health, Drugs and Substance Abuse, Education and Economic Empowerment, Information and Services, Opportunities Gap in the Rising Drug Addictions and Unproductivity among the Male Adolescents and Young Youth. Keyword, the Boy-Child Focus. Yesterday, Dr. Joy talked about primary health care and the importance of advocacy and community impact in the community level, in level 1. That is why primary health care is very important, and we were having discussions yesterday about the community health promoters, and I am one of them, and I'm very proud because of the work that we do day to day in the community. So we'll start by laying the background, and I have my Mwakenya so that I make sure I don't forget the most important bits. So the first thematic area was SRHR, Sexual Reproductive Health and Rights. And today, according to the Shujaz Incorporation National Representative Survey that was carried out in 2016 to 2022, today 1 in 5 Kenyans are 15 to 24 years, a rough estimate of about 11 plus million. And when the bracket is widened up to 35 years, we'll find that we have over 40 million young people in Kenya. And this is a very significant demographic that whose matters need to be really considered at as even Dr. Nazri was saying, that the youth population is the largest today in the country. And also, according to the Kenya Demographic and Health Survey 2022 report that was released earlier this year, it stated that slightly more than half of young people only know about HIV prevention. That is 54% for the women and 55% for the men. And you can remember, I think it was 2 weeks ago, in Citizen, the National Syndemic Diseases Control Council, which was earlier known as NAC, the National AIDS Control Council, it released a report that 62 young people aged 10 to 19 are infected with HIV every week. This is a very, very alarming report which needs all of us to come and think again, just like Dr. Odhiambo David was asking us, what next after such reports being released, what next for the young people? And we'll go to the next thematic area, which is mental health, which is today's focus. And research shows that today, 6 in 10 young people have experienced challenges with their mental health, majority reporting experiencing feelings of depression, anxiety, and panic attacks. And conversations with young people in the community reveal that without the vocabulary to express the experiences, they fear encountering prejudice or judgment, preventing them from seeking care. And especially where I come from, in Dandora, we usually you know that's where the dump site is, and our neighbors are Korokocho slums, if you know about them. And this is an area where is majorly infested with drugs and substance abuse, because did you know that even some of the the tablets used in Madare Hospital. I know them in our local language. We call them the tab, the white ones. The young people, they use them to get to a certain high that they are looking for. This is after smoking cigarettes, smoking bang, taking alcohol, does not reach them to the high that they want. So they take those tabs, which are for the mentally ill people, which are usually dumped in the dump site because they are accessible and they are used. So the National Authority for the Campaign Against Drugs and Alcohol, Against Alcohol and Drug Abuse, NACADA, released a report in May this year stating that today 1 in 53 Kenyans aged 15 to 65 nationwide use cannabis, and this is only cannabis or bang. And NACADA placed the prevalence rate in Nairobi at 6.3% as compared to the national average, which is at 3.4%. So Nairobi is using bang and other drugs and substances double the country. So you can imagine why. Is it because drugs and substances are cool? Is it because they are good? Are they benefiting the users? So the fourth thematic area was education and economic empowerment. And according to the Shuja's report also, right now 100% of youth have to work to earn an income as compared to 2016, which was 47%. Few employment opportunities have left 95% of youth aged 18 to 24 years working in the informal sector. And mind you, this is a demographic of more semi-skilled and unskilled labor. I know yesterday we were talking about young people who are healthcare professionals, but for us, this abstract was on the other side of the spectrum. The youth that are in the informal settlements like Dandora, where I come from, the youth that are not necessarily professionals, the youth that are still in the community that probably only finished Form 4 and they have nowhere to go. Most of them, they lay idle in the community. Most of them are the ones that we call nowadays Kamagera, the ones that are in the stage trying to fill up the matatus, and most of them use drugs. When you talk about the relationships with their sexual partners, the matters of intimate partner violence and sexual gender-based violence, because of the conflicts arising, especially now with the high cost of living. Because mind you, these young people are unemployed in the community, they need to provide for their young families. And when they can't get a means, they end up in even crime. And even right now, we still have a challenge of crime in the informal settlements. Dandora is always known for crime, and people fear coming to Dandora, even organizations, just because they fear crime and security. But in Dandora 1 and Dandora 2, we are lucky to have a partner that deals with young people in terms of SRHR and mental health. They are known as the MSF, the Medicines Sans Frontiers, or the Doctors Without Borders. They set up a very classic and youth responsive center in Dandora 2 Health Center, and it operates from Monday to Saturday, catering for STIs management, HIV testing services, pregnancy testing services, the ANC, the antenatal care for the teenage girls that are pregnant across Dandora and even Korogocho slum. So the method of intervention that we came about was partnership and collaboration and consolidation from interested national, county and sub-county stakeholders for resource mobilization and funds allocation by the beginning of this year's last quarter, starting from 1st October 2023, for the birth or formation and structuring and the establishment of what we call the Bright program. This is because we saw that the girl child has been empowered for some time now, and we have seen fruits of empowering the girl child. Many organizations today are empowering the girl child, as even you can see right there, that roll-up banner, that Adolescence 360. Their vision is stated very clearly, supporting girls in making the best choices for their future. But how many organizations do we know that are presently working to empower the boy child, focusing on the boy child only? So this BRIGHT program, the abbreviation for the name BRIGHT is Boy Child Rehabilitation Initiative for the gradual and holistic transformation of the boy child. And we thought that was a bright idea. And thank you. So our proposed solution was that the boy child has long been left out of conversations, and hence the rising culprit of new drug addictions, crime, especially with the current perpetual rising cost of living. And our proposed solution is that a lot needs to be done in prevention and rehabilitation of youths, especially the boy children who use alcohol, drugs, and other substances. Since it's the biggest monster affecting the boy child, it's where they find solace from. Because when they are idle, we know that an idle mind is the devil's workshop. So with all these pressures of mental health, because someone is looking at their life, maybe they're 25 years old, they don't have a skill or a course that they have done, they're still in the community. They just resort to drugs and substance abuse because of the pressure that comes with the expectations from their family and society. And so, by the national, county, and even sub-county stakeholders taking up our proposal, this will ensure that we are catapulting or nearing to achieving the sustainable development goals, such as the SDG number 3, which is good health and well-being for all, including the boy child, which is also the theme of our summit, and SDG number 4, quality education, because we need a program that shall be tailor-made for empowering the boy child in terms of SRHR, mental health, drugs and substance abuse, and education and economic empowerment. I think we all know about the DREAMS program for the girls in our wards, the one that is supported by LVCT mostly, that it makes sure that it empowers the adolescent girls and young women in school, and even those that have cleared Form 4 and maybe joining colleges, on matters of, they have a program such as My Health, My Choice, financial capability training, STIs testing and prevention, and in case they find girls that have been, they have teenage pregnancies, they refer them to the partners in the community such as MSF and even LVCT and Maristops. So also SDG number 5, gender equality, decent work, SDG number 8, decent work and economic growth, SDG number 10, reduced inequalities, and SDG number 17, which is partnership for the goals. And that's why I'm standing here today advocating for the plight of the boy child. So where does this lead us? It leads us to concluding and recommending that the boy child is at the brink of a crisis if no urgent intervention takes place right now. We have seen and heard of the Second Lady, Honorable Dorcas Rigathi, also really advocating for the rehabilitation of the boy child. And even in our proposal, we invited her to actively participate in this formation and implementation process, since she is on record advocating for the rehabilitation of the boy child. And in case of any interested like-minded partners that are present today, I have the soft copy of the proposal, which is focusing on the rehabilitation and the empowerment of the boy child. We want to see roll-up banners like this one that are saying support boys and young men in making the best choices for their future also. Even boys and young men deserve a table where decision making and policy making processes are taking place, so that we cannot be left behind anymore. We want to be also at the center of the conversations, so that we can have an equitable and equal society where we shall all benefit. And that's my presentation. Thank you.